everyone. I'm Brian Block from Simkiss and Block, and thank you for joining us today as we go into executive session with our friend Dan Hilferty, the CEO of Independence Health Group here in Philadelphia. Thanks for joining us today, Dan.
Thank you, Brian.
So Dan, since becoming the CEO here about 9 years ago, you've seen the company almost triple in size and now serve over 8 million Americans in more than half the states in the country. Are there any lessons learned, and is there any advice you can offer to CEOs who are trying to drive rapid expansion in their own organizations?
The main advice would be understand as a leader what your strengths are. I feel really confident in my ability to vision, to think of what the possibilities are. I'm very confident in team building and bringing folks who have strengths that I might not have to the table so we get the best of everybody's thinking. And then I think the third thing is be bold. Work closely with your board to make strategic decisions, make investments in places that may not be all that apparent when you make the investment, but ultimately lead to a successful entity, a successful partnership, and add to the portfolio of businesses. It's important for us as an upper mid-level size company to really be strategic around partnerships, be strategic about diversifying our portfolios of business, and also being very strong in managing and overseeing them efficiently.
Speaking of health insurance and your place in the industry, there probably has never been a time in the history of our country that's seen this much innovation in health insurance. And middle market private sector employers are certainly a core constituency of your organization and of ours. What are some of the ways in which you think those companies should be prepared to perhaps have to adjust to changes in the traditional model of employer-provided healthcare?
So Brian, first of all, I'd like to commend you for the incredible business that you and your partners have developed. I think it's important, I say that because who are a trusted advisor, trusted consultant / broker for your clients, and we, the deliverers of comprehensive health benefits, we've got to be working together to make sure that we bring those innovations to the customer in a way that they see they're worthwhile, they see the pathway to a more efficient product, and they see the pathway to a comprehensive program that their employees are confident in, and it provides a stickiness for those employers to keep their employees, ranging from bringing together different technologies to create a real-time set of information that clinicians, that consultants or providers, payers can work together to create the best care pathway for every individual and for a population. An example would be our new partnership with Comcast called Quill. Quill will be a system that uses their distribution channels, everything ranging from internet to cable to entertainment, combined with our knowledge of the industry. And certainly working with partners like you to get the right pieces of data in place to help people better navigate the system. Help us to develop products with your assistance and partnership that meet the needs of a very population of companies, be they mid-sized, be they small, be they startup, or be they large national accounts. That's the focus that we've had, and we're very proud of it, and some of the other innovative partnerships that we're developing.
In what ways and how soon do you think this is likely to really impact the average consumer, the average American family?
The Quill partnership between Independence and Comcast, both Philly-based major employers, both committed to the same type of innovation, both proud to be Philadelphia area companies. It seems to me it's a more natural fit. We're in healthcare, they're in entertainment. That being said, individually, we keep an eye on Amazon because we think there might be an opportunity for us through Quill or directly or working with folks like you to engage in an Amazon. I mean, there's got to be an opportunity for us in an era of real time to work with an organization like that. I'm fascinated by the combination of CVS and Aetna. Aetna's a competitor. They'll always be a competitor. We believe competition is good. But when you look at the growth in the spend on the pharmacy benefit, for us, for example, it has now overcome the amount we spend, the percentage of our spend on clinicians, on doctors, primary care and specialty. Think about that. Yeah. The provider side, many providers in this marketplace and across the country are looking at getting into the payer space. And as they do that, how do we interact and work with them? Does it force us to move more into the provider space? It remains to be seen. So there's all sorts of unique alliances that are emerging while government is trying to figure out where it wants to take this. We believe a public-private partnership is the best way to go. We don't think Medicare for all is a solution, and we don't think it should be all private sector. So it's going to be interesting. You've got all these unique alliances in the private sector and kind of a fractured political infrastructure trying to figure out where we're taking this thing.
Independence Blue Cross has many employees right here in your headquarters in Philadelphia, but the Independence Health Group has many employees elsewhere as well. Do you have any piece of advice for CEOs and leaders of somewhat decentralized organizations in terms of how to drive a corporate culture and a unified message when they may have team members that are physically thousands of miles apart from one another?
First and foremost, we at Independence really pride ourselves in the culture that we've built. A culture of inclusiveness, of camaraderie, of really looking for the best solutions for the company. So what we've tried to do over the past 9 years is instill a level of confidence in each associate, be they management on through the ranks, that you have a voice. And that voice should be heard. We should be willing to have respectful dialogue back and forth, even when we disagree. And it's about inclusiveness across a diverse body of people who come to work every day. And therein lies, for us, the secret sauce of a culture where people feel part of something fun. You combine that with a vision that says, we want to be the best health insurer in the world. We are ready to partner with those who are like-minded. We're going to put our money where our mouth is in terms of diverse portfolio of businesses that we'll invest in. And you create that aura that is about that inclusive, honest, creative environment that you want to construct.
I couldn't agree more. Yeah. I can't think of a company that does more for Greater Philadelphia than Independence. It seems like your Blue Crew is everywhere all the time, but that has a real cost to it, both a hard dollar cost and certainly a soft cost in terms of the time and energy of thousands of employee man hours that aren't spent directly in the business. Why is that so valuable to Independence?
When you think of healthcare, roughly in our business, somewhere between 85 to 95 cents of every dollar goes to healthcare. The resources we use not only to administer and operate the business, develop a strategy, we also put a portion of those resources aside to be a leader in investing back in the community, supporting good causes, be they healthcare causes around cancer, diabetes, heart health, mental health, whatever it might be. We believe that if you look at that small portion of our overall revenue that we put in those buckets, it all comes back. If I see what you do in the community, if we invest in a community in North Philadelphia by setting up health clinics, supporting any number of community-based health centers, helping a project to eradicate homelessness or connect a provider to a needy community, we believe it is a step towards creating a healthier community.
I couldn't agree more, and on our own scale, we have a very similar type of attitude in our organization. Given the competing demands of work and family and community involvement, do you have any advice for other busy leaders on how to bring some healthy balance to your life with all those things pulling at you?
Brian, I think of you. I mean, you're a husband, a father. You run a very significant business, and I know you struggle with that every day, as I do, and many of us, all of us. So here's how I look at it. We developed what we call the rules of the road, and there's two key components. Have fun when you can. Yeah. It's not always fun. Yeah. But finally, have that work-home balance. When you're finished your work, go to your family, go to your pet, go to your community, go to your partner, and put the devices down, regenerate, refresh, and when you come back, you'll be better for the task at hand. So what I've tried to do on a Friday afternoon, I focus on Joan, my wife, and that's important to know who our relationships are, what's important to us. And then we have 5 children, 3 grandchildren, and really trying to be present to each of them as they face their own hurdles, their own challenges, and their own victories, whatever they might be. And it's by doing that, forcing oneself to understand when it's time to shut down and go home. I firmly believe when we come back on a Monday, when we come back after an extended vacation, we're better, we're fresher, and we're ready to re-engage at a very high intellectual, spiritual, and soulful way.
Well, Dan, thank you so much for making time to speak with us today and for all that you and your terrific team do for my firm and our employees and for the community at large. It's truly humbling and fabulous to count you as a friend and to count you as a corporate leader in our region here.
Well, Brian, first and foremost, thank you for having me. And at a very personal level, those values that we've talked about, they're who you are. And your company is in incredible hands because of your leadership. And having these executive forums, I think, is so important because we all learn from each other. So congratulations to you on both a personal level and certainly a corporate leadership level. And keep doing what you're doing. We all need it.
Thank you so much for your time. Thank you for joining us today, and we look forward to being with you next time on Executive Session.